So you've now heard the case for and the case against. Each gets a chance for a rebuttal. So Dave, see what you can come up with.
So I'm doing a rebuttal from the podium. So how many of you have ever tried to give a rebuttal to a guy with that accent? All right, we just, it does never sound as good, never sound as smart. So I'm going to try my best. 49 patients, John, 49 patients. You yell at me about 19, and yet you're making a decision for an entire health system based upon 49 patients. So the numbers are small. The reasons that the numbers are small are because it's incredibly difficult to have patients participate in a trial of this sort. In fact, in the United States, just until recently, we had an open trial for photodynamic therapy along with chemotherapy. Actually, it was a multinational trial that closed because it's so hard to recruit patients to this type of trial. Patients want to be treated, so randomization takes an incredible generosity of self, and so that's a challenge. And we may never be able to develop better data prospectively randomized than the data we have now, because over the last 15 years we've been trying to push that forward. A few points were made, and I think I would be remiss if I didn't mention the fact that photodynamic therapy has some side effects or has one particular side effect that neither one of us discussed that it's important for you all to know, which is the medication that we give makes people sensitive to light. And so patients who want to spend their time outside, and I live in Philadelphia, so all my patients from the New Jersey shore who want to spend their time gardening and on the beach, this may not be a good therapy for them because they are incredibly sensitive to light. Now, that sensitivity can be treated, it can be managed, and it does improve over time, but photosensitivity and sunburns are things that do happen. As a matter of fact, one of my patients even got a sunburn at a night Eagles game from the lights of the stadium. So the guy with the Eagles shirt right there, there are others fighting the fight alongside with you locally. A comment was, John made the comment that all the patients were jaundiced, and that does not necessarily correlate or is not representative or is not generalizable to all patients. And I would agree with that comment. I think if you do not have jaundice, then the benefit of opening up the bile ducts to alleviate jaundice, which is what I believe the primary therapeutic effect of photodynamic therapy is probably not for you. And then there's the question about the way you administer therapy. So we'd love to say we were, in our presentations, we were sharing apples with apples, but in fact we're doing a little bit of apple to orange deception. Because as I understand it, in the UK, the way the Photostent 2 study, what trial was designed, was a one-time therapy of photodynamic therapy that would happen and not followed with additional therapies. And the German protocol and the one that's largely adopted in the United States is one of every 3-month procedures. And in fact, I believe it was a 2012 publication that had follow-up data from the same group. If you look at their 3-month data, at 3 months, the liver tests are still down, but that's when they're starting to go up again. And so one of the questions to ask is, repeated therapy, repeated treatments, does that have an effect differentially? Secondly, there has been an evolution in the skill set and the tools that we have available to us. And so those prior data that show excellent results have perhaps a little bit more challenge with them with today's additional therapies. The evolution of metal stents can make it perhaps that we should say, well, maybe we should just put in metal stents and not think about it. But in fact, from European advocacy, there's a level 2 recommendation of performing photodynamic therapy, even from inside bile ducts that have metal stents in them. And in fact, some of the patients who were presented in the data in the prior studies also had metal stents in. The presentations that we had earlier demonstrated an immense elegance in understanding of the science of how we treat patients individually, thinking about their molecular biology and thinking about the way we need to approach patients. Photodynamic therapy is the same. Not every patient is eligible for treatment. Not every patient is going to benefit from it. And it takes a real dedication to be able to undergo this. In a meta-analysis that looked at 170 patients, cholangitis or infection happened in about 15% of those patients. But yet there was still a survival benefit looking at kind of pooling all of the available data. So I would advocate for a subset of patients, particularly those subset who are challenged by the issues of biliary obstruction as a dominant form of their disease, which is the dominant method of presentation for perihilar cholangiocarcinoma, that photodynamic therapy should be a mainstay of treatment. Thank you.
Thank you, David. I'll make this brief. So you've heard that really the original Ortner data, that small German study, randomized study of 19 patients versus 49 patients. 49 is more than 19. My colleague, my colleague is an excellent, extremely sophisticated plumber of the first order. He's not a mathematician because 49 is more than 19. The other point is the randomization issue. So I think the randomization issue is absolutely critical. Without the randomization issue, we wouldn't have got to where we were with this. Through my conversations with Stacey and others and meetings of this group, and indeed Helen from the UK, I completely appreciate how being a patient randomization can sometimes be a most formidably difficult thing to understand and appreciate. Why am I not getting something extra? Well, first of all, randomization is critical in determining whether something works or not. And quite frankly, if it weren't for randomization, we wouldn't be in the situation where we would be highly suspect of using PDT outside of an extremely carefully controlled scientific situation where all the problems that we fished out with PDT in our study, where all the problems were carefully controlled. So that's probably the only situation you'd look at it. And then you'd have to prove it in a randomized study. So this is one of the reasons why randomization is so terribly important. And finally, as for the Germans clearly are still doing PDT, but because after the 19-patient study, they invested a huge amount of money in buying a large number of machines, and they're very efficient at putting people through PDT. It's not something that we would do in the UK. Thank you.
Thank you both. And just before I discharge the combatants, I wonder if we can go for a quick show of hands now that you've heard what you've heard. Who is in favor of pursuing PDT? And who is not? And who's just not quite so sure? Okay, maybe we need to revisit this again in the future. Thank you both.